if we're concerned about delivering information over the cloud, right? Then can I also deliver it over a mobile device, being that a lot of those interactions go through the cloud?
Yeah, so be careful on your mobile environments. If you have a managed mobile environment, then you may be ready for HIPAA compliance, the FedRAMP compliance, et cetera. And many mobile app vendors just don't care about security. But some do, and they will help protect that on your generally unprotectable devices. So we often think that if a username and password is asked for on a application, that your data is of course secured. That couldn't be farther from the truth. So the data, any data that's residing on your mobile device can be stolen, and if it's not protected properly through appropriate means, can be taken off of that device without your permission. Even if you're just walking around, you have Bluetooth turned on, there are ways of being able to pull data off. But the good news is there are lots of ways of protecting it. The thing to watch out for, though, in mobile is that mHealth is a buzzword these days, and lots of people want you to follow mHealth. They're not quite sure why, but you're not quite sure why, but we're all pretty sure we should be doing it. Now here the problem is that we don't want to think about mHealth in terms of mobile devices. We want to think about mobility in healthcare. What makes patient care better, faster, or cheaper? What makes physician behavior improve better, faster, or cheaper? How do our nurses become more optimized? How does our supply chain become more optimized? How is our operations improved because we're on a mobile device? If you're thinking like that and you're skeptical, that's a good place to be. I mean, you're going to be blamed, oh, healthcare guys are just, behind the times, they're not moving fast enough, but that's okay. We have to deal with patients. That's our primary goal, and it's okay to be behind the times because you're going to get a lot of people telling you, go into mHealth without saying what are all of the business benefits behind it. And we're often taught about that, right? Always look for the business benefit. But when you have a shiny new iPad app or you have a shiny new Android device, you start to think, oh, by itself it's going to make a difference. But no, by itself it's actually going to make your job much worse. Securing those devices is a lot harder. And unless you have significant improvement from those devices, you shouldn't even plan to put them in. And until you have operational or clinical benefits that you can see, just stay away for a little while.